Hello everyone, I hope you all are doing well. Today we're going to be talking about the Petal Clovers study. And the PI for this study is Dr. Timothy Albertson, and the sub-investigator is Dr. James Chenoweth. So let's start by talking a little bit about sepsis, which is also known as septicemia. So sepsis is a life-threatening condition where the body has an overactive or toxic response to an infection. And this can be caused by any type of infection, such as a viral or fungal, or even by parasites, but bacterial infection tends to be the most common. So what ends up happening during sepsis is that the immune system, in the process of fighting an infection, ends up causing harm to the body instead. And this is due to the overactive response. So there are chemicals that are released in the body as part of the immune response to like an infection or an injury. And this can cause certain things to occur. One such thing is inflammation. And inflammation is pretty common as part of the immune response because it can end up allowing a lot of blood cells, especially white blood cells, to reach an injury quick, which can help prevent an infection from occurring. However, if too much inflammation occurs, then this can cause blood vessels to start to burst and leak, which can end up causing blood clots to form. And if this ends up happening to a very severe extent, then this can end up causing organ damage because blood is no longer able to flow to the organs. Another thing that's caused by the immune response is vasodilation. Vasodilation essentially means the expansion of the vessels to allow more blood to flow through them. And this can allow for white blood cells to be able to quickly reach the site of an infection. However, if this occurs to a very strong extent, then this can cause a low blood pressure to occur as well. One thing that I wanted to clarify is that sepsis is not the same thing as blood poisoning. So sepsis is defined by the body's overactive immune response to an infection, while blood poisoning is an infection being within the bloodstream. So both of them are different things. One is defined by an infection and the other is defined by the immune response. So they should not be confused for each other. Alright, so let's talk about some of the symptoms for sepsis patients. So one of the main symptoms is a low blood pressure, and as I mentioned in the last slide, this is caused by the vasodilation. Some other symptoms that can be seen in sepsis patients are fever, chills, low body temperature, fatigue and weakness, a fast heartbeat, sweating, clammy skin, and severe pain. So some of these symptoms are pretty common as to what you'll see, for example, if a person has a cold or a flu. But again, this is much more dangerous for them. And it is the sign of something much worse happening. So if sepsis ends up progressing and getting worse, then this can end up leading into severe sepsis, in which there ends up being signs of organ dysfunction occurring. So some signs that you may see in a patient are difficulty breathing, low or no urine output, abnormal liver tests, and changes in mental status. And these are all signs of some sort of organ possibly not functioning the way it should be. And if the patient's status or condition gets even worse from severe sepsis, this can lead into septic shock. So septic shock is defined by the blood pressure dropping to dangerously low levels. And this is very dangerous for the patient because blood pressure indicates whether blood circulation is occurring to a satisfactory level. And if the blood pressure drops, then that means that blood circulation is no longer occurring throughout the body sufficiently. And this can lead to complete organ failure, which can lead to death. So for sepsis, there is currently no clear treatment for it. There is no clear way as to how you can prevent the immune system from overreacting to such an extent that it causes harm to the body. But instead, sepsis can still be managed within the hospital. And it is usually managed by the ICU team, or the intensive care unit. And what they tend to work on is treating the infection which is causing the sepsis. So for example, if it's a bacterial infection, then a patient will be given broad spectrum antibiotics so that the body can get a little help fighting that infection. Additionally, they will work on maintaining the blood pressure in the patient. So there are two main ways that this can occur. One is through the use of IV fluids. So IV fluids are useful because you are essentially putting so much fluid into the body that the blood pressure ends up increasing through that process. So one analogy that kind of helps visualize that is by thinking of a hose. So for example, let's say you have a hose and you start increasing the amount of water flowing through it, then that starts to increase the pressure. Another way to maintain a patient's blood pressure is by using vasopressors. And vasopressors essentially constrict the vessel to help increase the blood pressure. So again, going back to the hose analogy, in order to increase the pressure, you end up making the hose smaller, and that can help. So overall, the ICU team is going to work on doing these things, and also work on keeping the organs functional and the patient as healthy as possible. Let's start talking a little bit about the study itself. So the purpose of the study is to compare the impact of two different strategies on the 90-day in-hospital mortality in patients with sepsis-induced hypotension, which is basically just low blood pressure caused by sepsis. So the two strategies that will be compared are the restrictive fluid strategy and the liberal fluid strategy. So the restrictive fluid strategy is basically going to be looking at mainly using vasopressors to manage the low blood pressure. Specifically, the research team will be using norepinephrine. And the vasopressors will be given such that the MAP, or the mean arterial blood pressure, is somewhere between 65 and 75. So in case the patient does not seem to be clearly recovering using these vasopressors, or it's seen that there's a decline in their condition, then rescue fluids or IV fluids will be given, and there will be specific rescue criteria met before these fluids are administered. The other strategy that the researchers will be looking at is the liberal fluid strategy, and the patient will be administered IV fluids until either 5 liters of fluids are administered or clinical signs of acute volume overload develop. Basically, there's a limitation as to how much fluid our bodies can handle, and if there are signs that the body is reaching that point, then they're going to stop administering the IV fluids. And yeah. So if it's seen that the patient's condition is declining, or it's seen that their hypotension is not being managed, then rescue vasopressors can be administered as well, depending on if certain rescue criteria have been met. So the inclusion criteria for the study is that the patient should be 18 years or older, and they should have had a suspected or confirmed infection. And this will be defined by the administration or planned administration of antibiotics. And we can find this out by going into the medications tab once we click into the patient's chart. Additionally, at least one of the following 3 criteria should be true for the patient, or should be applicable for them. So one is that the systolic blood pressure should be less than 100. And the systolic blood pressure is going to be the number in the numerator. So for example, it would be 120 and 120 over 80. Another possible criteria that can be fulfilled is that the MAP, or the mean arterial pressure, is less than 65. And we can find this out by going into flow sheets and then going to acute vital signs. If the MAP isn't listed there, then you can also calculate it using the blood pressure. And then one of the other criteria is that the patient is currently receiving at least 1 vasopressor infusion. So norepinephrine was one that we mentioned earlier, and some others are epinephrine and vasopressin. And we can find out if the patient is receiving any vasopressors by going into MAR. Some of the exclusion criteria for the study is if the patient has received more than 3 liters of IV fluid. In order to find out how much IV fluid the patient has received, we can go into MAR, or we can go into flow sheets and go into IO. So IO stands for input and output. So the 3 liters of IV fluid also include the amount of IV fluid that may have been administered in an ambulance if the patient was brought into the ED in an ambulance. And in order to find out the amount of fluid that they received there, you can go into the EMSF report. And this can be found if you go from chart review into the media into pre-hospital documentation. So some IV fluids to keep an eye out for are normal saline, lactated ringers, plasmolite, albumin, and blood products. And these can be found under the medications tab in the patient's chart. And just to clarify, we want to specifically look at the amount that the patient has received, not the amount that's been ordered for them, because this amount will be administered over a certain amount of time. And if the patient is a prisoner, or if they are pregnant, then they will also be excluded from the study. So let's talk a little bit about screening for the study. So some chief complaints that we want to keep an eye out for are sepsis, 944, hypotension, septic shock, altered mental status, weakness, fever, and any kind of infection in general. So some common ones are UTI, for example, or urinary tract infection, or BSI, bloodstream infection. Also, when screening, you can look in the communications doc plan, which shows up in the trackboard, or you can go into the notes in the patient's chart and look for some key terms like sepsis or ICU. ICU is especially one to keep an eye out for, because if a patient has sepsis, then they will almost certainly be transferred into the ICU care. We also want to keep an eye out for IV fluids, shock, bacteremia, and infection. So what are we supposed to do as RAs? one of our main jobs is to screen for patients who potentially qualify for the study. If we do see any patient that may qualify for enrollment, then if possible, we want to check with the patient or with a physician to confirm that the patient is eligible. If they are, then you want to page the Petal Clovers team. So if you go into the ED research office and use the computer there and then go into Citrix, if you scroll to the bottom, then there is a link to use an online pager. And then we're going to enter the pager number. This is on the one-page summary as well, and you're going to include the area code. And then for the message, you're going to say that there's a possible Clovers patient. You're going to mention the patient's MRN, their room number, and your name, and that you're an MRAP. For the callback number, you can mention that you can be reached via Visera. Or you can also put in the ED research office's phone number and ask if the RC or JS on shift could talk to the Petal Clovers team in case they call. And then something that's really important about this study is that it is very time sensitive. If a patient is suspected to have sepsis, then treatment and management for the condition has to occur very quickly. So that means that IV fluids can be quickly administered as well. And if you remember from the exclusion criteria, then the patient can be excluded from the study, or they will be excluded from the study if they have received more than 3 liters of fluid. So that means that as soon as we see a potential patient, we want to contact the Petal Clovers team so that they can start looking into the patient, see if they qualify, and they can start the enrollment process very quickly before the patient has reached that 3-liter threshold. So yeah, that's it for the study. If any of you have any questions, then feel free to reach out to the head trainer or the senior trainers, or you can also contact Abby. And yeah, I hope you have an amazing day.